Hi, everyone. I'm Susan Feniger, and I'm so proud to serve as a board member of the Scleroderma Research Foundation. Like so many of you, scleroderma has a very personal impact on my life. In the 80s, my very, very dear friend and college roommate, Sharon Monsky, was diagnosed with scleroderma. When she later founded this organization, I was honored to join her to try to find a cure for scleroderma. Today, I'm excited to introduce what I know will be a fascinating conversation, starting a nutritional journey in systemic sclerosis, presented by Dr. Elizabeth Volkmann. Now, of course, anything to do with nutrition and food is right up my alley, so I know this is going to be an incredible conversation. Dr. Volkmann is an associate professor and director of the UCLA Scleroderma program at UCLA here in Los Angeles. There she serves as not only the director of UCLA Scleroderma program, she's also the founder and co-director of the UCLA Connective Tissue Disease-Related Interstitial Lung Disease. Now, that is a mouthful for someone who's a chef, but I know it's going to be so important. Her research focuses on the discovery of novel biomarkers that predict response to the ILD targeted therapies. She also has an enduring interest in exploring how the gut microbiomes contribute to the pathogenesis of ILD and systemic sclerosis. Dr. Volkmann is the proud founder of Women in Scleroderma, a nonprofit organization that is dedicated to advancing the careers of women scientists and clinicians working in the field. Now, I just love this. I love that it's supporting women scientists. I mean, everybody, but women, it's just fantastic. Anyways, thank you all for your support. Let's get this disease figured out. With that, I want to turn it over to Dr. Volkmann.
Hi, everyone. Thank you, Susan, for that kind introduction. I'm so grateful for the opportunity to speak with you today about starting a nutritional journey when you live with systemic sclerosis. I like this quote because to me, it really embodies what we're trying to do when you start a nutritional journey with systemic sclerosis. So this is Helen Keller, and she said, "What I am looking for is not out there, it is in me." And when many people start their nutritional journey when they have systemic sclerosis, they look outside. They go to the internet, they go to social media, they may meet with a nutritionist or dietitian to get advice about how they should adjust their diet to improve their health when they have this condition. But the problem is that every one of you is very unique. And so there's not ever going to be one diet that works for every single patient with systemic sclerosis, right? We all come from unique cultures. We have unique genetic backgrounds. We live in different parts of the world where the climate is different or the access to certain foods may vary. And because of this, your diet may be very different than another patient with scleroderma. And it doesn't mean that one diet is better than another. But if you learn to honor your uniqueness and what you need to feel well in terms of your nutrition, the journey becomes a lot simpler. I think one of the best ways to start a journey when you have this disease is to keep a food diary. And you're doing this to understand how eating certain foods and beverages make you feel. And the only way to know this is to really write things down. And the process can seem tedious, but it's also a form of self-care and time just for you to discover more about yourself and again, connect these symptoms that you have with specific foods. So here's, one example of a diary, and I don't recommend being too complex with the symptoms. I would try to focus on the top 5 symptoms that you experience on a daily basis. So for many patients, they experience heartburn, difficulty swallowing, as well as constipation or bloating. So we're going to focus on those 3 common symptoms that patients with systemic sclerosis experience. But there could be other symptoms that bother you outside of your gut. Like, for example, you may have fatigue or brain fog. Try to pick the 5 that occur almost on a daily basis. And then each day you're going to rate how much that symptom is bothering you. And you may do something like on a scale of 1 to 10, with 10 being very severely, you put a number in the box. Or here I've just done a even simpler approach of doing none, some, a lot. But you decide how you want to rate the severity of your symptoms every day. And on that same page, you're going to write down everything that you ate that day. And I guarantee that over the course of a month of doing this, you'll be able to start to make connections between what you're eating and how it's affecting your symptoms. And keep in mind that what you ate that particular day might not just affect your symptom that day, but it could affect your symptoms the following day or even 2 days later. When you start your morning, it's a good idea to just tune into your body. So most of us, when we get out of bed in the morning, we may use the bathroom, but we often start scrolling our phone, catching up on the latest news, or you may be rushing to help get kids up and ready for school. But just try to take a few minutes in the morning when you're in bed to do a quick symptom check. In doing this, you kind of scan your body and you tune in, how do you feel, or even how did you sleep the night before? And then what you're going to do is tune into those sensations and then make a plan for how you want to try to eat that day to minimize those symptoms. So, for example, many patients with systemic sclerosis experience more heartburn in the mornings and at night. And this is again because when you sleep at night, you're mostly reclined and the reflux tends to get worse. So if you wake up with that bad taste in your mouth, or you were up a lot during the night with reflux or even choking, you're going to tailor your diet that day to try to help minimize eating foods that might exacerbate your symptoms and instead eat foods that might improve your symptoms. So when I think about heartburn and reflux, this is really what we call a heat symptom, right? So heat is something that gets generated in your body and heat rises. So anytime, something is moving in the wrong direction upwards, this could be a sign of heat. And a simple approach of managing a heat symptom like heartburn or reflux is to try to eat less hot foods that day, foods that are going to increase the heat in your body, and instead eat foods that are more cooling. So you're going to let the thermal properties of the food be your guide. And here's an example. So a lot of patients are familiar with the foods that have heat properties. So these are your spicy foods, peppers, tomatoes, onions, a lot of meat, especially red meat or anything oily. These foods often produce more heat, more reflux. And so if you wake up one morning and you notice that you're having more reflux or you had more reflux the night before, these are foods you generally want to avoid or limit that day because you're only going to get worse. But alternatively, there's some foods that have cooling properties that you may want to start integrating into your diet that day if these are foods that you tolerate. So cucumber, watermelon, and mint, these all have cooling properties on the body and could potentially help you if you're having more reflux. There's a type of bean called mung beans, and these are very neutral and can also help in terms of the reflux that you're experiencing. And then if you're open and interested to doing some kind of supplement, aloe vera juice can also have a cooling effect on the GI tract. So when I work with patients about their nutrition, I try to make it just as much about what to avoid as what to embrace, because I think psychologically it's easier to make changes to the diet when you're not just focused on what you need to restrict yourself from, but also what you can enjoy and embrace during the day too. There's other important lifestyle modifications that can be quite important as well. So, again, because at night you're sleeping usually in a reclined position, you're more likely to have reflux disease. So you want to pay close attention to what you're eating for your last meal of the day. You definitely don't want to eat less than 3 hours before going to bed. And this is because, again, you may have delayed emptying of your stomach contents, and this could, again, provoke more reflux at night. Even when you're eating, more than 3 hours, it also depends on what you're eating. So animal fats, proteins slow your digestion down because it takes your body longer to break down the complex fats and proteins that are in these substances. So again, if you're going to have an evening meal, I would try to limit the amount of animal fat and protein that you're consuming. If you want to consume those foods, it's better to have them earlier in the day so your body has, several hours to digest them before going to bed. You could also consider drinking an herbal tea that's more cooling after you eat. So something like chamomile tea can be very calming and also, again, cooling for the GI tract. And then definitely you want to sleep on an angle. Most patients with systemic sclerosis experience a problem where the bottom part of the esophagus, the sphincter, the lower esophageal sphincter, becomes rather loose. And it stays open all of the time. And normally you'd want the sphincter to be closed unless you were eating so food could pass into the stomach. So if it stays open all of the time, you're generally okay if you're sitting upright. But the moment you lie back, that's again where you can get the reflux into the esophagus. So wedge pillows can be helpful. Sleeping on an adjustable bed can also be quite helpful. And I've even seen patients who put bricks under the bottom surfaces of their bed just to give a little bit of an incline. If you're sleeping with a wedge pillow, don't be too hard on yourself. It's not uncommon to fall off the wedge during the night. But the key time that you want to try to be on the wedge is in the early part of the night, again, closer to that evening meal. If you fall off halfway through the night, that's okay. The second symptom that many patients with scleroderma experience is difficulty swallowing. And this can be due to a lot of different causes. So some patients will have difficulty with their esophagus and the muscles contracting properly. We call this ineffective esophageal motility, and there are tests that you can do to diagnose this. But sometimes difficulty swallowing has nothing to do with the esophagus, and it's more related to having dry mouth, which is another common symptom that patients with systemic sclerosis experience. And you can imagine if you can't lubricate your food well in your mouth with saliva, it's going to get stuck because it doesn't pass down so easily. But regardless of whether your difficulty swallowing is due to a problem with your esophagus or dry mouth, what you really want to do that day, if you're experiencing some difficulty swallowing, is incorporate more moist foods and try to avoid dry foods or rough foods. So what do I mean by this? So rough or dry foods include chunks of meat, particularly if they're rather big, bread, bagels, crackers, chips. These are very dry foods. And even though you may think, oh, well, a cracker dissolves in my mouth, like why wouldn't I be able to swallow it well? Well, I've had many patients choke on crackers and chips because it's so dry that it gets stuck in the throat area, even though it seems like it's a really small piece of food. But there are moist foods that go down a little bit more easily. So these would be your pureed vegetables, vegetable soups, particularly ones that are not rich in dairy, yogurts, and there's a lot of non-dairy yogurt options if you can't tolerate cow's milk, and even fruits. And many patients with scleroderma cannot tolerate raw fruits, but you can have cooked or stewed fruits like blueberries or raspberries. And these, again, provide a little bit more moisture and are often easier to swallow. Other lifestyle changes that you can make if you have difficulty swallowing, you want to chew all of your food carefully. And this may seem very obvious, but it becomes more difficult if you have systemic sclerosis and you also have difficulty with your teeth, as many patients do. And so it sometimes becomes just difficult to chew at all. And if that's the situation for you, you really want to be eating softer food so you're not putting an extra burden on yourself to, cut food very small or, chew and cause your jaw to have more pain. So again, if you're going to have fruits, try to have the ones that are a little bit riper. Give yourself time to eat. It's not uncommon for my patients to spend twice as much time eating as their family members, and it's okay. So you don't need to keep up with the pace of how other people are eating. Probably in the US, we all eat too fast anyway. If you go to Europe, there's a lot more slow eating. So you can just pretend you're in Italy and take your time and chew your food properly. And if you need to take sips of water between, eating food, that's okay to do. Many patients, particularly patients who have difficulty with their esophagus, will drink a gulp of water to help push the food down. And that's totally fine to do. All right, what about constipation? This, again, is another common symptom that patients with systemic sclerosis experience, and it can be due to different causes. So again, sometimes it's related to the colon muscles not contracting properly, and so you get something called delayed colonic transit, where it just takes longer for substances to move through the colon. Small intestinal bacterial overgrowth can also be a cause of constipation and distension. And this is when you get a pretty severe imbalance in your gut bacteria that causes you to have more gas and bloating, which can then block up your intestines. But again, regardless of the cause, there's some simple things that you can do if you wake up and you feel more bloated or more constipated. In general, I again try to keep it simple. You want to avoid white foods, and we'll go through what that means, as well as alcohol. So any product that has baking powder in it, so these are going to be like your breads and pastries, these are going to make your constipation worse by and large. Alcohol often does as well. Anything refined or processed like bagels, again, tortillas, breads, these are not going to help your constipation, and they could actually make it a lot worse. Foods with added sugars can also be difficult, particularly if you have this small intestinal bacterial overgrowth, because these kind of bad bacteria that over-proliferate in this condition and produce a lot of gas, they really feed off of these sugars. So if you're eating a lot of food with added sugar, you're just kind of helping these bacteria to take over, which we want to avoid. But there are some foods that can be helpful. And again, papaya is something that often helps people with constipation, asparagus, and I would recommend cooking the asparagus, figs, raspberries also. And again, like if you can't tolerate the raw form of these fruits or vegetables, you can try cooking them a little bit or even putting them in a simple smoothie. Other lifestyle recommendations, I always advise my patients, if they can, to take a gentle digestive walk right after eating. If you walk a little bit after eating, it stimulates your gut motility. And it's best if it's done immediately after eating. If you eat and then sit down or watch TV or lay around for a little bit, I find that the walk is not as effective. But if you eat and then just make a point of taking a 5 to 10 minute walk, this often really helps move and empty the stomach. And you don't need to take a vigorous walk. It doesn't even need to be a walk outside. You could walk within your home, but just try to move around a little bit before you sit down, and definitely before you lay down. Many patients will get dehydrated when they have systemic sclerosis, and so if you are dehydrated, it's only going to make the constipation worse. So really try to keep up with your fluids and do this during the day. So don't wait to drink water or liquids only when you eat. You actually want to be drinking more of your liquids between meals. So if you have to keep a water bottle with you, that can also be helpful. I also recommend deep breathing exercises into the abdomen. I feel like this kind of helps with some of the uncomfortable sensations that arise with constipation, like pain. And then find ways to release your stress, because when you hold on to stress, you almost like hold on to your bowel movements too. So if you can include some mindfulness into your day, like again, the breath work, meditation, yoga, even again for 5-10 minutes a day, it sometimes can really help your GI symptoms. And again, I started this talk by telling you how important it is to really think about your diet in a personal way. So I would have caution when consulting the internet, because many patients don't get advice about nutrition from their regular rheumatologist. So they're looking for solutions. And when you go on social media, sometimes you're getting advice from people that may not even have, licensed degrees in nutrition. or dietary care, and they may not even, know about systemic sclerosis, and how the diet can help, or changes could even hurt you. And then I would have caution if you, come across anyone that says they can cure your autoimmune disease with a specific diet, because, this is such a complex disease. If it was that simple and we could cure this disease with one diet, no one would have systemic sclerosis. Everyone would be cured, but it's just not true. And I think I would be very cautious. What these people say can sometimes be helpful, but parts of it are helpful, but I wouldn't expect a cure of systemic sclerosis just by, trying the autoimmune disease protocol diet, for example. And a lot of what you'll read might even be contradictory. So you may, read something where it says, gluten-free is the best, and other things say, no, you need to eat gluten. And that can generate confusion. So I really recommend coming back to your food diary. If you're confused about whether or not you think gluten or dairy is affecting how you feel, you just start keeping track of it in your diary, and your body will tell you if it's something that helps you or hurts you. And when you do change your diet, make sure you consult your healthcare team before making the change. It's always good for me, for example, to know if a patient, let's say, has decided to become vegetarian, because I know that I might have to monitor certain vitamin levels in that patient because they might not get enough, let's say, vitamin B12. And so you'll want to let, your rheumatologist and gastroenterologist know if you're making a pretty big change to your diet. And I think with all autoimmune diseases, including systemic sclerosis, gentleness is the key. So instead of making a gigantic sweeping change to your diet that might be hard to sustain in the long term, try just making one change at a time. So if you want to, explore eliminating animal dairy products, you just try taking that out for a period of time and tune into how you feel. If you make 6 different changes at one time, it's going to be very difficult to know, if you feel better, was it the dairy or the soy or the gluten? Because maybe some of these things you can eat and others not. You don't want to restrict your diet to the point where you can't eat anything. And so I would make one change at a time and do it in a gentle way. And then I wanted to end by talking about supplements, because I often get questions about vitamins and the use of vitamins for systemic sclerosis. And, there's no evidence that taking super high doses of any vitamins improves your health. In fact, there's more evidence that if you take too much of a supplemental vitamin, it can be harmful. So for example, if you have too much vitamin B12, it can damage your nerves. If you have too much vitamin D, it can cause kidney stones and worsen your constipation. So if you do use supplemental vitamins, again, when you see your healthcare provider, you're going to give them not just a list of your medications, but a list of your supplements, because someone should be monitoring the levels of these vitamins in your blood if you're taking extra supplementation. There are some common vitamin deficiencies that we see across many patients with systemic sclerosis. This was a scoping review that we published a couple of years ago, where we looked at a number of studies that had been published in patients with systemic sclerosis reporting specific vitamin deficiencies. So here you can see the most common vitamin deficiencies that can be present in patients with systemic sclerosis. And we've categorized them based on where they're absorbed in your gut. So you can imagine if you have small intestinal bacterial overgrowth, you might have a more difficult time absorbing the vitamins that are under the category of small intestine absorption. But sometimes you can get deficiencies not just from your gut not absorbing vitamins well, but from actually not taking in enough foods that have that vitamin. And we see that a lot with vitamin C deficiency, where many patients who have reflux disease avoid all citrus foods, and then they don't get enough vitamin C in their diet naturally. So if you're, seeing your doctor, you can ask them to check the levels of these vitamins in your blood. And then if you do have a vitamin that's low, you can selectively replace that vitamin. So instead of taking, 12 different vitamins every day, very indiscriminately, you're going to do this in a much more selective way. You're going to find out, okay, what vitamins am I deficient in and which ones do I need to replace? And then once you start on a supplement for, let's say, vitamin C, you're going to make sure that your doctor is monitoring the level of that so you don't get too high, that you stay in the normal range. And, lastly, it's important to give your gut some love. This is a, part of your body that often is affected when you have systemic sclerosis. And it's quite normal that when you have pain or discomfort or any problem with an area of your body to kind of start to resent that area. But I really view physical sensations in the body as mere signals for the areas that actually need more healing and more love. And so I would recommend taking a different approach, the opposite approach, and try more self-love. So ways that you can give your gut a little bit more love and less of that resentment is to, throughout the day, just put your hands on your abdomen and just, think about talking to your gut in a comforting way. Imagine if you were holding a baby who had a stomach ache. You wouldn't get mad at the baby or resent the baby's stomach ache, right? You would do really calming things. You might rub their belly. You might talk to them in a soothing way. You should be treating yourself in the same way that you would treat a baby or a child and give your gut some love because it's really speaking to you and telling you, this is the area that needs more attention right now. So to summarize, your daily symptoms can guide how you eat on any given day, and you may have to adapt your diet day to day depending on how you feel. But you don't need to be perfect. The key is to finding the right balance where you still can, feel good about eating and share meals with other people, but at the same time, know your limits and know that, if one day you do eat a food that is going to cause problems, that if you do get problems, you just wait a couple days, things will get better. But sometimes just having that knowledge of what is making things worse or better can even, put your mind more at ease when you have systemic sclerosis. And I have a monthly, newsletter that I send to my patients with tips about nutrition and other holistic approaches for when you have systemic sclerosis and other autoimmune diseases. And I'm happy to share this with you today. So if you use this QR code or this link, you can sign up to receive this monthly newsletter and you can unsubscribe at any time. But again, I want to thank the Scleroderma Research Foundation for giving me the opportunity to speak with you today. And again, I hope you enjoy the rest of the talks today.
Dr. Volkmann, thank you so much for that informative presentation. And a special note of gratitude for both your expertise and time. I heard you just had a baby boy 2 weeks ago. Huge congratulations to you and your family.
Thank you.
Hello to everyone joining us. My name is Dr. Omar Baker, and I'm honored to serve on the board of directors of the Scleroderma Research Foundation. I joined the board because of my personal connection to this disease. My mother passed away from complications of scleroderma when I was a first-year medical student, and my mother-in-law is currently dealing with it. That's why being part of this community and events like this, today's forum, means so much to me. You've submitted some wonderful questions. I hope we can get to as many of them as possible. Let's go ahead and get started. Dr. Volkmann, our first question says, I wonder sometimes what I can eat. So many things bother my stomach. It's very hard to figure out because it's not the same things all the time. Do you have any recommendations or guidance for this patient?
Yeah, it's a great question. It's something that a lot of patients experience, so you're definitely not alone. And what can happen is that sometimes what you eat can bother your stomach and sometimes it may not. And this may have less to do with what you're eating specifically and perhaps the time of day that you're eating. So I mentioned in the talk that if you're eating foods later in the day, like with your evening meal that are high in fat or even really high protein, this slows down your digestive tract. So you may experience more problems with reflux and bloating when you're sleeping and you're laying down. So pay attention in these cases to what time of day you're eating, because some foods might be better tolerated earlier in the day where you have a longer time between when you eat and when you go to sleep. The other thing to keep in mind is the food combinations. And so I didn't go into it too much in this talk, but I've spoken about it in other nutritional talks where if you're combining something like a fruit, which is a carbohydrate that should be digested relatively quickly in the GI tract, again, with something with high fat or high protein that will slow down the GI tract, what can happen is if you have slow gut motility, that fruit can be digested more slowly, it starts to ferment and cause more gas. So if you're going to have something like fruit, berries, I would always have them on their own, sort of as an in-between meal snack rather than combining it with a meal. So those are just kind of two tricks to think about if you're wondering why, sometimes a food bothers you and sometimes it's not. Think about the time of day you're eating the food and also what you're combining the food with.
Very helpful guidance. Thank you. Next question. Is it recommended to go on an anti-inflammatory diet? If not, what diets do you recommend?
Another great question. The anti-inflammatory diet has a lot of wonderful principles that I think could be used to help guide you if you feel completely lost about what diet to go on. It's perfectly fine to look at the anti-inflammatory diet and try to follow it. But what I will caution you with is that this diet doesn't work for everyone, and it's not a very personalized diet. So there may be things on there that you don't tolerate. And what I don't want to happen is you go on it and you feel worse and you think that it's the diet, but it could just be a component of the diet that's not good. It's also a highly restrictive diet. And for some patients, for example, they can tolerate gluten and others cannot. And so I would just use these types of diets as a guide. It's not wrong to try to follow them, but just keep in mind that you may need to tweak the diet to meet your own personal needs.
Excellent. Thank you. How often should one be tested to see if nutrients are in fact absorbed or not absorbed by the GI tract for those scleroderma patients who have GI involvement?
Another great question. I mentioned during the talk that we try to check people's vitamin levels so we can see whether you're absorbing vitamins properly. And this is important because sometimes we don't know if you have a vitamin deficiency unless we look for it. I would recommend that if you have any GI symptoms at all, to ask your doctor to check a broad range of vitamin levels. And then moving forward, you can always recheck those vitamins that are deficient. So what I will typically do with a patient is measure, a whole bunch of them, 10 or 11 different vitamins. And then if we see, for example, that their zinc is low or their vitamin C is low, I'll put them on a supplement that just targets those vitamins. And then I will recheck in 6 months and make sure that it's working. If it's not, we might try another brand of vitamins. We might try to incorporate more foods that have vitamin C and zinc. But I do this in a really systematic way because I also don't want my patients wasting a lot of money on vitamins they don't need. So if their vitamin levels are normal, there's no need for them to take an excess amount of vitamin B12, for example, because having too much of a vitamin can also be dangerous in some situations.
Yes, that's wonderful advice. So, as we know, scleroderma is a disease that also affects caregivers and those who are caring for their loved ones. We have a question that came in regarding a caregiver's mother. She's asking, what can she do to help her mother? She believes her mom has reflux symptoms to liquids.
Yes, and that can happen. So reflux doesn't just happen with eating, spicy food or chocolate. Many people will have reflux to liquids. And what I would say is that it depends a little bit on what liquid you're having. So if you're drinking coffee, that's a known cause of reflux, but some patients will even choke on their own saliva. And in these cases, what you want to make sure is that someone with severe reflux is always drinking when they're in an upright position. And you want to remain upright until about 3 hours after eating or drinking. The reason being is that in scleroderma, there's a part of the esophagus, the tube where your food passes or your liquid passes, right before the stomach that's called the lower esophageal sphincter. And this should stay closed all the time unless you're eating or drinking, and then it will open up to allow the food or water to pass to the stomach. What happens in scleroderma is the sphincter starts to loosen, and it basically stays open all of the time. So if you're seated upright, gravity will help keep the liquid and food down in the stomach. But the moment you recline, it can start to go up. So you basically don't want to recline until the contents have left the stomach. And this often takes at least 3 hours, sometimes longer for some patients. So I'd say one change that you can make to help your mother is to make sure that she's staying upright after eating or drinking for at least 3 hours. And then also to just do small amounts, because if someone is at the point where they're choking on their saliva, they probably have very slow gut motility. So they're going to have to take a lot longer to eat or drink than the average person.
Excellent. Thank you so much. Is there a connection between constipation and heartburn?
100% there is. If you have constipation and heartburn, what can happen is if your constipation is associated with your belly getting more distended or you have more bloating and you lie down or recline, that pressure can actually push up on the stomach and then make the heartburn worse. So I have a lot of patients where they tell me it doesn't matter if I take my heartburn medication, I still have heartburn or I still feel a bad taste in my mouth. Then I ask them about constipation and then they tell me, oh yeah, I only have a bowel movement once a week. And once we treat the constipation, the heartburn actually gets better. So I would say if you suffer from heartburn and your symptoms aren't well controlled with medication and lifestyle changes, think about constipation. You really want to try to have a bowel movement once a day if you can.
Excellent. Great. So we have time for a couple of more questions. This one's related to sweets. The specific question is, do artificial sweeteners have the same negative impact as regular white sugar or natural sweeteners such as honey or maple syrup?
Yeah, it's a great question. I think that the intention behind artificial sweeteners was to obviously sweeten food, but then do it in a way that wouldn't expose people to excess amount of sugar, which we know can lead to things like diabetes and other cardiovascular diseases. But now more research has suggested that artificial sweeteners can actually have their own array of problems. One of which is it can disrupt the balance of your gut bacteria. And there's evidence that artificial sweeteners can cause dysbiosis, or again, an imbalance in your gut bacteria. They can contribute to leaky gut syndrome. So I would say I would try to minimize your use of artificial sweeteners and instead do the more natural sugars, but just do them in a small amount so that you don't have excess sugar. And I think if you were going to choose a natural sugar, you want to try to choose not like a white sugar that's refined and added to food. You want to more have foods that naturally have the sugar in it. So a little bit of honey is fine, that the maple syrup is okay. Obviously, fruits have their own natural sugars, but I would try to stay away from the artificial sweeteners.
Well, so we have time for one last question, and we apologize for there's so many great questions that came in, and the team here at SRF will find a way to get some answers to those questions we couldn't tackle. But for Dr. Volkmann, our final question is, you mentioned a light walk or being somewhat mobile after eating is a good idea. What if a patient's unable to walk? What do you suggest?
Yeah, no, that's great. And I think what you can do, there's some alternatives. So one, it would be, they have these little pedal devices, which are just small, little, like the size of a step stool that have a pedal that you could just cycle your legs if you're sitting. That can be helpful. You can do some exercises where you raise your leg. With my little baby, I sometimes pedal his leg to get things going. So you can do this without walking, no problem. And also just simply even doing the abdominal breathing that I talked about, putting your hands on your belly, taking deep breaths in where you kind of push out your hands. Again, this will start to kind of stimulate that area after you eat. So you don't have to walk, but for many patients, walking is what they prefer.
Well, thank you again, Dr. Volkmann.